My name is Gautam Malhotra, and I'm a general physiatrist here at Everpoint Health. I evaluate and treat neuromusculoskeletal conditions and perform electrodiagnostic testing. Because I grew up with physician parents, medicine was always in my life, and I wanted to explore everything even before considering a life in healthcare. It turns out the word doctor comes from the Latin word for teacher, and I found I love teaching, and I was a physics major, choosing the challenge of studying science. Also, I've always enjoyed the high that comes from having helped someone. So helping and teaching is just baked into the cake of the encounter with each patient I meet. At Everpoint, the physiatrists, or physical medicine and rehabilitation specialists, focus on returning to the original mission statement of physiatry, which is to restore function. This means different things to different people. It could be more like sports medicine, where an athlete wants to return to high performance levels after an ankle sprain, or an elderly lady compromised by a recent stroke who wants to be able to take care of herself and not depend on her family, and everything in between. Time in the room face-to-face allows three things to happen: a complete unloading of everything on their mind, a comprehensive physical exam, and ensuring that they're thoroughly educated on the relevant aspects of their diagnosis, their history, the natural history of what's going to happen if they don't treat it, and all of the risks and benefits of actual treatment. So this also helps them manage their own expectations. No one remembers anything the doctor says, so I always try to offer a printout of my report before they leave so they can discuss with their family afterward. So time spent with them to help them restore function, this is what we want to offer first and foremost here at Everpoint. A successful outcome is obviously when someone reports their symptoms have resolved and they've returned to their desired level of function. But for me, I also want them to be empowered with the knowledge of how they both developed and resolved the problem. This is directly related to prevention of flare-ups, conversion to chronic pain, and it's usually what I find was previously missing in their care. Well, there's great research showing better outcomes when you have an interdisciplinary approach to care. Typically, healthcare systems offer multidisciplinary options where lots of specialists are available to you in one place. Interdisciplinary care means those same specialists are talking to each other, arriving at a diagnosis together, and then agreeing on the optimal treatment plan. At Everpoint, we build this into our work week, and we make ourselves available to each other throughout the day. If I can walk over next door and show the MRI to the spine specialist, I've saved that patient a month while they wait for an appointment to get that same answer. When I talk to the physical therapist on the phone 2 weeks after the patient has started therapy, I can immediately order new diagnostic testing or bring the patient back in for an injection if things aren't going right. This saves the patient another 6 weeks while they wait for a follow-up with me. So even though time is sacrificed on the front end communicating, the patient saves far more time and money in the long run. At Everpoint, we truly believe this is the way to optimize outcomes and the overall experience for everyone involved. I'm a clinical professor, so I'm currently involved with teaching residents, but my life outside work is pretty full. I have 2 young daughters, and I've been the lead singer in multiple gigging cover bands. I also have a few published albums of original music.